Have you ever wondered what is chiropractic? Maybe someone's even referred and stated that you should go see a chiropractor, but you're not real sure what chiropractic is or how would it even help you. If that sounds like you, then this video is for you. Hi, I'm Dr. Chris Shiflett, owner of Trident Elite Healthcare and retired Navy SEAL in Heath, Texas. And this channel is about providing tips, tricks, and strategies to promote your health and maximize your human potential. Today, I'm going to be discussing what is chiropractic, and I'm going to use a pre-recorded video. The information is still good and valid, so I hope you enjoy. See you soon.
The first thing I'm going to do is I'm going to show you the Texas Occupational Code. This is an individual business plan that I had to do for one of my classes. So in that, I looked up and found the Texas Occupational Code for chiropractic, which essentially defines the scope of chiropractic in Texas. So here you go, Texas Occupational Code. Here's the reference, Chapter 201, Subchapter A, 2020. So you can go look at that. This is when I pulled it, not necessarily the date of the revision. So you can go pull this up and see it for yourself. So right here, uses subjective and objective means to diagnose, analyze, examine, or evaluate the biomechanical condition of the spine and the musculoskeletal system. So it's important to understand what all this even means to begin with. And I think some of this may make sense and some of it may not, but an objective finding is anything that can be documented, recorded, and shown as evidence to someone else. So, and this will sort of go into my next topic, which is going to be how to choose your chiropractor. So I don't want to go down that road too much, but basically said an objective is a measurement of some sort. So let's say you have decreased range of motion and flexion. You have a hard time, or maybe cervical. You can't flex your chin, your chest, or extend back all the way without pain, or it's just reduced in general. Excuse me. So, and the doctor can measure that. He can see what it is that you have and what it should be. And so if it's less than what it should be, that's an objective finding. That's a measurement. Subjective is the patient history. So you come in complaining of pain, that's a 6 out of 10, where someone else may have the exact same finding and they call it a 2 out of 10. So that's subjective to the patient, and that's a little bit better way to differentiate those. Biomechanical condition, and that's different from musculoskeletal. Musculoskeletal is the bone, the muscles, the tendons and ligaments. It's the structural things. Biomechanical includes the nervous system, neurotransmitters, chemical mediators, receptors. That's the biomechanical portion. So right here, this is letting you know that a doctor of chiropractic doesn't just mess with your muscles, doesn't just, crack your joints. There's more going on to that, which I'm going to get into in a minute. Dr. Chiropractic does all this non-surgically and with non-incisive procedures, including adjustment and manipulation to improve the subluxation complex and the biomechanics the biomechanics of the musculoskeletal system. The subluxation complex, this is the most important thing, at least in my opinion, and I think among chiropractors that we all agree on this. The subluxation complex is what chiropractors are removing, and that's what chiropractic does. So that's not to say that a chiropractor doesn't care about your symptoms, doesn't care that you're in pain, and isn't trying to improve those things. But that's not what he's doing when you come in for chiropractic care. The goal of chiropractic care is to remove the subluxation complex. And the subluxation complex is basically a blockage of your nervous system transmission, so it slows it down. And then you might be able to think of this as an accident on the highway. So when there's no accident on highway, traffic is flowing fine. You get an accident on the highway, it goes down from 4 lanes to 1, and now you're able to get through. It's just going to take you a long time. That's similar in how the nervous system works. So when you get a subluxation complex that reduces the flow of information across the nervous system, you end up with problems. Okay, moving on. So, going back to this subluxation complex, there's three things that cause this, and that's very important to understand: chemical, physical, and mental emotional. So again, this feeds into what I was saying about when you go in to get an adjustment, it's not just moving the bone, and maybe the bone doesn't even need to be moved at all because maybe the bone isn't out of place. Maybe you have a subluxation complex as a result of inflammation. That would be kind of chemical. Or stress. Stress can cause chemicals to release. So it can be one of these three, or it can be two of these three, or all three. There's no rhyme or reason. It's just these are the three basic things that cause it. And I think, logically speaking, most of us could recognize that there's no way we can get away from these three things in our everyday life. And that goes into, again, this coming up post, but when somebody asked or had heard that once you go to see a chiropractor, you always need to see a chiropractor. And there's truth in that, but not the way that it's typically understood. And so some people think that once you go see a chiropractor, you need to see him 3 times a week for the rest of your life, and that gets too expensive. But that's not the case. And this goes into time. So let's just use myself as an example. I did 16 years in the military before I was medically retired. And before that, I played all kinds of sports. And so my body has undergone a tremendous amount of stress to the the vertebra. I was going to say spinal cord, but it's the vertebra really that's been affected. So I'm 36 years old and I already have degeneration in my spine just because of all the abnormal stress that my body was placed under. So if I go in to get chiropractic care and I expect to walk out day one free of any symptoms that I may have had, that's not the best way to look at things, because it's going to take time. It took time for my body to get to that point. It's going to take time for my body to heal from that point. And that's the other main part of this, is that chiropractic improves your nervous system function to improve your overall well-being and to maximize your human potential. And it does that through self-healing. So you improve the nervous system flow of communication that allows your body to respond to those stresses and heal itself. And you might be asking, well, if the body can heal itself, then why do I need to go to a chiropractor at all? You need to go to a chiropractor because the subluxation complex, it exists, and it's not going to be, you can't just fix it on your own. And so that might be the next question is, I can crack my own back or crack my own neck, so why do I need a chiropractor? Again, I'm trying not to get too off track because that's for a topic of how you pick your chiropractor. But the basic simple answer is a chiropractor is trained specifically to locate the subluxation complex. So yes, you may be able to rotate your head and crack your neck or rotate and crack your back or whatever, but what you may be missing, and so here's just an example of a spine, but let's say, you're having lumbar pain and you rotate and you get a crack down here. But what happens if this, first of all, the crack that you hear, it's just gas releasing. So it's not even what we care about in chiropractic. If it cracks, great. If it doesn't, who cares? Because that's not what we're trying to fix. We're trying to fix the nervous system. And so we have to check it, find it, clear it, and then recheck it to make sure we cleared it. So let's say you move this segment right here, you twisted and this segment moved. But what if it was this segment that really needed to move, this segment and this segment, because whichever one is stuck, let's say this one, it's hypomobile, so it has lack of mobility. The one above and the one below becomes hypermobile, moves excessively to make up for the lack of movement here. So when you move and you get that crack, you may get it from here and here, but not here. That means you never fixed this area and you made this problem even worse because this was already hypermobile. You moved it even more, which means you moved this one even less. So if you crack your own back and you might get instant relief, but then just shortly, a little while later, you get the pain again. That's why, because you didn't get the adjustment. So only a chiropractor is trained to find those and remove them. Um, okay, sorry, enough on that, hopefully. But basically, the big takeaway from that is how you're measuring success of chiropractic and chiropractor should not be through the relief of your system solely. Yes, your symptoms should improve over time. And over time, if they're not improving and you decide, okay, this isn't working for me, then maybe go find a new chiropractor, or something like that. But you have to give chiropractic the opportunity to work because remember, it's your body that's healing itself. And the chiropractor is just facilitating the release of the complex so that the nervous system can function better. So a better way to assess or judge whether or not chiropractic works, or your understanding going in for treatment should be to improve your nervous system. And so your chiropractor should be able to give you objective findings and then after the adjustment show improvement in those findings. Whether it relieves your symptoms of pain or not, that's important. I know that's obviously important to you as a patient, but that's not the goal. So you need to make sure that you understand that did he find an issue with your nervous system, he or she, and did they make it better, even if it was just a little bit? Yes or no? That's kind of how you should assess whether chiropractic works and whether the chiropractor did his job. But again, that's another topic. I'm going to leave it at that. Moving on here, the Texas Occupational Code. So they have to present to the public that they're a chiropractor, a doctor of chiropractic, a DC, the legal lingo. And then goes on, the practice of chiropractic does not include surgery or incisive things, does not include prescriptions or controlled substances, drugs, any of that stuff, and it does not use radiation therapy. So this doesn't say that a doctor of chiropractic can't use x-rays to assess or examine or analyze. It's just saying that they're not going to use radiation as a form of treatment therapy. Like in cancer patients or something where you might use radiation to, kill cancer. We're not doing any of that stuff. So that's it. That's how the Texas Occupational Code sees it. I'm going to put it more broadly that I think most chiropractors can agree on. Chiropractic is a science, art, and philosophy with a premise on removing the subluxation complex for well-being and maximizing human potential. That's what chiropractic is. Now, but real quick, I'm going to hit it on those three things: science, art, and philosophy. So the science of chiropractic is what we do in terms and on the scientific scale. So the things that we do have been tested, they've been researched, they've been, and I know some people are going to say research states good and bad. I got it. Again, that's another topic. But the science is there. It's been tested. It works. A lot of the things we do, Medicare accepts what we do. That means the federal government accepts what we do. Social Security, all that stuff. So it's accepted as a treatment. And it's been tested and researched. That's the science part. Science part of it can include x-rays to analyze range of motion and all those things. The art and the philosophy are kind of somewhat interchangeable, but the art is more specific to what the chiropractor is doing in terms of technique. So you may, and this is important for you to understand as a patient when you go in to get in treatment, especially if you find one that you like, Ask them what technique they use if you don't know already. Because then, if they leave or if you move and you go to try to find a new chiropractor, you understand the technique that you like. So that's the art. The philosophy is just the ideology behind what the chiropractor is doing. So if he's using a specific technique, he has a philosophy on why he's using that technique. And that's all it's basically saying in a nutshell.
That's it. I hope you enjoyed the video. Hopefully you got some good information out of it and a little better understanding about chiropractic, how it works, what a doctor of chiropractic is doing, that sort of thing. And don't forget, if you like this video, you want to see more, don't forget to subscribe and like. That way you can get notifications of our upcoming future videos. Thank you guys. Take care.